welcome. This is the 2025 4119 or 419 Emancipation Operator NOFA Pre-Application Conference. So today we're just going to be talking about what's in the NOFA, what's required, and we're also going to be providing some time at the end of the call for Q&A. So that leads me to a couple of housekeeping things. One, if you are not speaking, please mute your mic and save your questions to the end of the conference. If you think of a question and you don't want to forget it, just drop it in our chat feature because at the end of the call, we'll go through all the questions in the chat and answer those. So, slide deck will be provided as well as a recording after the call. So if you miss anything, don't stress. It will be provided to you. All right. So my name is Lindsay Broom. I'm a staff analyst here at the Housing Department. I work with our NOFA team. So I will be kind of your point of contact for everything NOFA related. So if you have questions, they go through me, which I'll discuss a little further later. But yes, so I will be your point person. We do have several of our team members that are on the call. Many of those will be presenting today. So I will let them introduce themselves as we get to their slides. And so I'll just jump right in. All right, so the funding and the solicitation schedule. So this funding is up to $30 million in what we would call our Community Development Block Grant Disaster Recovery Funds, which we call CDBG-DR24. They are intended to support the operation for a 36-month period or 3 years. There are other potentially non-federal funds that may be available, and we can, discuss that a little bit later, but that is there as well. And one thing to note is that these funds are provided via a monthly reimbursement process of approved eligible costs. So if you haven't received funding from the city before, the way that we do it is the agency covers the money up front, and then they complete a reimbursement request and we reimburse them on the back end. So our timeline is the NOFA was issued on December 12th. Today we're having our pre-application conference. Question submittal deadline is January 16th. And what that means is after you review the NOFA and you kind of starting to work on your application, I'm sure questions will come up. So please submit those questions by January 16th at 5 p.m. Because that gives us enough time to review the questions, get your answers, and publish them in a letter of clarification. So that's an important date to remember. And the actual deadline for submitting the application is January 23rd, again at 5 p.m. And I will go in a later slide, I will discuss the process for submitting the applications. All right, so I am going to hand it over at this point to Melody Barr and Jared Briggs if they would like to introduce themselves. Thanks.
Great, welcome. My name is Melody Barr. I am the Assistant Director for Public Services here at the Housing and Community Development Department, and I am here with my colleague Jared Briggs, who is our Division Manager over Public Services. And I believe we can go to the next slide. And Lindsay, just let me know, do I have the ability to move the slides or do I just need to say next slide?
Just say next slide.
Okay, I will do that. So this NOFA overview is that the City of Houston is launching a new 24/7 stabilization center at 419 Emancipation. This is part of the Mayor's In-Street Homeless Action Plan, and this facility will serve trauma-informed and easy entry hub for individuals experiencing unsheltered homelessness, those that are living on the street or in places not meant for human habitation. The goal is to divert people from incarceration, emergency rooms, and street encampments, and providing immediate shelter, care, and pathways to permanent housing. Now, this NOFA is seeking qualified nonprofits or local government entities to operate the center for a 3-year period. Lindsay mentioned that earlier, with approximately $30 million in federal and local funding. Next slide. So this is an overview of our scope of service, and I'm pretty sure many of you have already pulled down the NOFA, which is on the Beacon system, and Lindsay will go through that. There's a lot more information within that NOFA for each of these categories in terms of what the scope of services is including. So the facility operations is 24/7 managed operation. We are looking for what type of safety protocols you have, the food, the maintenance, a surge readiness. So how are you going to address the weather events? Client intake and access. So what are your processes for walk-ins and referrals, assessments, ID issuances, and then keeping in compassion, how is privacy also put into play? The essential services, we're again looking for meals. How would you be able to manage the meals? Hygiene needs, clothing, pet care. Many of our street homeless individuals have pets that are their family members. Healthcare services, and then engagement with our community. And when I say community, I'm also referring to those that would be residing and taking shelter at 419. So behavioral health and clinical integration is part of the scope of services, on-site services, which would include peer support and a crisis response. Housing diversion pathways, our ultimate goal is to rehouse. We do have the expectation that coordinated entry assessments will be done and that there is linkage to permanent housing. Coordination and system integration. It is the expectation that anyone who enters the facility should be entered into the HMIS system. We want to collect the data to understand our community, coordinated entry participation, and again, with partner collaborations. What partner collaborations will you be bringing to the table? Disaster and surge readiness, emergency plans, backup power, Office of Emergency Management coordination. What policies and procedures do you have for weather events? Houston is known for having major weather events, and how would your process be able to address that? Transportation for residents and staff transport via direct or indirect methods. How would you be able to move individuals to the necessary appointments or to other pathways of housing? Compliance and reporting. We are anticipating and we expect monthly reports. If you've ever dealt with the city, you know that we do everything on a monthly basis. How we do perform audits, performance tracking, and data quality. Next slide. So to give you a little bit of information on the facility overview, this is located at 419 Emancipation Avenue on Houston, Texas. This campus is a 2-building complex on a little over 2 acres. There's a residential building, approximately 50,000 square feet of usable space, which includes 80 rooms, and there's 3 bedrooms per room max. There are full bathrooms in each room. There's a kitchen facility, recently updated, a laundry facility. There's clinic space and recreation space. The office building is a little over 1,600 square feet. The first floor only. These are for administrative and multi-purpose spaces. The capacity is up to 240 single adults, and this is based on the 3 clients per room. The population to be served would be individuals experiencing homelessness, including those with serious behavioral health challenges, substance use disorders, disabilities, or complex co-occurring needs. The City of Houston is in the process of owning the building. So 419 is to serve as a diversion point from our ordinance violations, incarceration, or emergency room hospitalizations by connecting individuals to stabilization, care, treatment, and housing. Next slide. This is going to be an overview of an aerial view of the building. So it is located in East Downtown. There is limited on-site parking. So if you're looking at the picture on the lower side, the south side, right above that orange line is where the parking is currently. And then around the area, you will find residential, light industrial, and commercial. Next slide. In the actual NOFA packet itself is a drawing similar to this. What we did for this presentation is color coded. Jared, do you want to go over this particular slide?
Yes, like you said, this is an attachment in the NOFA that you can download. That is a just black and white of the floor plans of the main building. So the first floor and the second floor. What we've done here is just color coded to kind of give you an idea for
Hey,
anyone that has not
Nisa,
been to the
sorry, just a
facility.
quick question. Um,
Can you
it
please
sounds like they want someone
can
to
you please hold your
run this whole
questions till the end?
facility. Are we going to run a
Thank you.
Yes. So we're
Yeah,
gonna
well-
hold questions to the end, or you can put them in chat.
So the facility, for those that are not familiar, it is 2 stories. The first floor, as outlined here in the color coding, you have the main entrance area, which is just next to the lobby. That kind of light greenish or teal color would be the main entrance. You walk in, and then the yellow area is the updated kitchen that was referenced. The facility is laid out to where there's a large open courtyard or atrium space in the middle that's noted by the green, and that goes all the way to the roof, and is the second floor does look down upon that. The rooms or dorm rooms that have up to 3 beds in them do have a bathroom facility or shower and toilet inside them, as well as sinks. Good, make sure everyone's muted, please. The other areas of note is there is a good amount noted in the pink of office and or conference space that can be used for on-site operations. There is also, with the red, that is a space that we believe is best used for a clinic space to provide on-site healthcare services and other health or mental health services as needed. The orange is laundry facilities, so there's significant laundry facilities on site, as well as the purple are ADA accessible bathrooms. So there's additional ADA access outside of the facilities that are in each dorm room. If we go to the next slide. And then this is just the second floor. Like I said, it is accessible by stairs. There is no elevator in the building that I'm aware of. And it is mainly just additional bedrooms on the second floor that has an open railing that looks down upon that courtyard space in the center. Is there anything else you'd like to add to that, Melody?
No, but I do want to reiterate that the courtyard space, it is inside. It is, sometimes when we use the word courtyard, occasionally we might think that's outside. So that green atrium courtyard area is all enclosed. It is inside. It is not an outside area. All right, next slide. So this is a list of the threshold requirements. This is also as well in the NOFA. So without this, the application is not able to move forward. So you cannot be debarred or suspended federally or with the city of Houston. You must be in good standing with the city. Current franchise tax account status must be current. So we would do check that. You have a current 501c3 status if applicable, or similar documentation for a unit of local government. 5-year experience operating a residential facility, shelter, or congregant facility serving at least 100 individuals. Experience with kitchen management and food services. Documented effective partnerships with health, behavioral health, and housing agencies. 90 days of operating reserves or a working capital. This could also be a line of credit. Ability to begin operations within 60 days of the subrecipient agreement execution. Uphold an easy entry with minimal restrictions approach. And have insurance coverage for your current operation. So if you are operating a building, we want to be able to see that you have insurance coverage. Next slide. So the scoring criteria is as follows. And again, when you look at the NOFA itself, it's going to have a lot more information as to what we are scoring. So organizational management is worth 10 points. And this is where we are going to evaluate the agency's administrative structure, their staffing plan, and operational readiness to manage a 24/7 easy entry facility. Targeted services. We're evaluating the applicant's plan to deliver comprehensive client-centered services that support long-term engagement and stability with a strong emphasis on high acuity behavioral health and substance use needs. Cost reasonableness. We're evaluating the justification of the proposed cost and the agency's fiscal responsibility. So how did you come up with the budget? Why, what is this per person, per unit cost, and justifying the level, looking at salaries, etc. Budget effectiveness is how we evaluate how well the applicant's proposed budget aligns with the stated priorities and the scopes of services. So this is where you're going to demonstrate how the budget aligns with the full scope of services and staffing needs, including any fees associated with partner agency services. We have included a draft budget template. The budget must be on that template. Experience and past performance. Oh, what did I forget one? I'm sorry. Data-driven evaluation. We're evaluating the agency's approach to using data to monitor performance, improve services, and measure client outcomes. How do you measure for success? And when success isn't met, how do you change that? And is it based on a data-driven approach? Experience and past performance. This is where we're evaluating the agency's experience operating similar facilities and delivering services to high acuity populations. Leveraging contributions. We're evaluating the agency's ability to contribute additional financial resources to support the project. Agency collaboration is where we're evaluating the agency's partnerships that enhance shelter operations and client services. Applicants should describe the partnerships that enhance facility operations, support movement of clients to other providers or housing. This is part of that housing linkage and client services. Next slide.
Melody, I think that was the last slide for the NOFA overview. I think we're moving into compliance now.
All right, sounds good.
All right. Thanks, Melody. So I wanted to say one thing before we move on to compliance about threshold and just the way our process works. So after you submit your application, it comes under what we call threshold review. And during threshold review, I'm going through that list that you just saw on 2 slides back. And what I'm doing is checking to make sure that your agency meets each one of those threshold items. When you get on to Begin Bid, it will have you supply documentation for each of those thresholds to, show that you meet that requirement. And if you do not meet the requirement, you will not move on to scoring. I do usually provide, a little bit of a cure period. If maybe you're missing something in the threshold, or maybe something was unclear, we'll go back to you and ask for that. But if we determine that you do not meet the threshold requirement, your application will not move on to scoring. So it's very important that you review that list early on. And if you have questions as to whether or not you are eligible, that you ask those before the question deadline. All right, so next we're going to move to our compliance requirements. And at first we have Lakeisha.
Good afternoon, everyone. I'm Lakeisha Tate. I work with the Real Estate Compliance with Housing Community Development Department, and I will be providing the City of Houston Fair Play Program requirements for the 419 Emancipation operated NOFA. The City of Houston Pair Play program, which is governed by Executive Order 1 through 7, and the purpose of the City of Houston program is to require certain vendors to provide certain employees a minimum level of health care benefits or to contribute a designated amount to be used to be offset the cost of providing health care to uninsured people in the Houston and Harris County area. Next slide, please. So, projects that are applicable to the City of Houston's Pair Play program requirements would be any professional services, construction, or service type contract that is valued at prime contract over $100,000 and any subcontract over $200,000, and this is including contingencies, amendments, supplemental terms, and or change orders. Next slide. The City of Houston Pair Play program applies to employees of a covered contractor or subcontractor, and this is also including your contract laborers who are over the age of 18, work at least 30 hours per week for that contractor or subcontractor with any amount of time under a covered or city contract or subcontract. Next slide. If a POP vendor decides to be a play contractor, that means they will pay by contributing $1 per covered employee per regular hour for work performed under the city contract. Covered employees are those that are over age of 18, work at least 30 hours per week for that vendor with any amount of time worked on a city covered contract or subcontract. The funds are deposited into a contractor responsibility fund used to offset costs for providing healthcare insurance to our uninsured people in the Houston and Harris County area. Unfortunately, the employees of the Pair Play covered contractors will not receive the $1 per regular hour for work performed under the contract with the city. Next slide, please. If a covered contractor elects the play option, then that contractor will provide healthcare benefits to the covered employees. The healthcare benefits must meet or exceed the City of Houston standard, which says that the employer will contribute no less than 75% per covered employee per month toward the total premium cost. And the employee contribution, if any amount, will be no greater than 25% of the monthly premium cost, and that is single healthcare coverage. Next slide, please. For additional information regarding the Pay or Play program requirements, HCD provides POP-related information, help forms, and updates through their website at www.houstontx.gov/obo/popforms.html. This concludes the compliance requirement portion as it relates to the City of Houston Pay or Play program. Thank you for your time, and we are excited to have the opportunity to collaborate with you all.
Thank you, Lakeisha. Next up, we have Chris Robinson with our complaints and appeals.
All right. Good afternoon, everyone, and happy holidays. I am Chris Robinson, like Lindsay said, and I am the administration manager of the complaints and appeals team, which we'll talk about in this section. Next slide, please. All righty. So with our team, there are two types of grievances that someone may be able to file. There's the complaint, and then there's the appeal. The complaint is something, generally something that anybody can file. Any member of the public can file a complaint about our HCDD operations or anything related to something that we have funded. And usually those types of complaints are about like how long something is taking, or some type of information that's in the program guidelines, or somebody may have discovered a conflict of interest. And there's so many things that you can complain about. Those are just a few. And usually we'll take in those complaints and respond within 15 days. In written form, whether that's by email or a letter. You can call our team and file a complaint. Or you can email us. You can come into the office and file a complaint. But the appeal process is a little bit different. This has to be done in writing. And these are usually about program determination. So maybe you were denied under this NOFA to receive assistance in the program. Maybe you are a homeowner that was denied assistance, or you think that your award should have been greater. So there's many reasons that you can also appeal, but they are limited to certain things. And generally we have 30 days to respond in writing to an appeal, but NOFAs are different. There's only 7 days for us to respond to a NOFA because these processes normally have to go rather quickly. So I'll get into deadlines a little bit later into this slide. Or in these slides, and just to note that appeals cannot be filed until after there's some type of determination made by the program area. Next slide, please. Alrighty, so again, who can file an appeal and who can file a complaint? Again, any member of the public can file a complaint. Any program participant or applicant can file a complaint. So a program participant will include those who are applying, any developers, contractors, subcontractors, agencies, anybody who's a part of this project that is providing a service could really be considered a program participant and file a complaint. However, appeals are different. Only program participants can file appeals. So if you are just a regular member of the public and you are not a part of this process, you won't be able to file an appeal about some type of determination, but that doesn't mean that you can't complain about something. Now, to file a complaint or an appeal, we will need certain information from you, like your name, first and last name, your location of your business, what the name of the project or NOFA is, your preferred method of contact and that contact information, and then also the reason why you are complaining or appealing. And so we don't take anonymous complaints or appeals, and you must have a reason behind the complaint or appeal. And HCD also reserves the right to decline an appeal if it is not within the deadline timeframe, or it is not one of the reasons that you can actually appeal. Next slide, please. Alrighty, so the appeal process is generally where we have the most concerns and questions. So I'll just go over that quickly. There is a 2-tier process. The third process only applies to DR17 programs, which this program is not funded by, so we won't have that level of appeal. So at the tier 1 level, the program area, in this case, public services, would re-review any information that was submitted in accordance with the type of appeal or the reason for appeal that was submitted. And they may grant or deny that appeal. And based on whatever that decision is, we'll have to determine the next steps. If the appeal is denied, or you're not satisfied with the resolution from the original tier 1 appeal, you can file a tier 2 appeal in which there is a group of employees, between 3 to 5 people who sit on the appeals review committee, and they will review everything from soup to nuts. And these people will not be a part of the public services group. They are a group that has no type of interest in this particular program. And then they'll render a decision, and that is usually the final decision. Now, in terms of timelines, appellants can file an appeal. It must be in writing, but it has to be within 5 business days of the award determination. So once you get that letter, you've only got 5 business days. And then we will acknowledge the receipt of your appeal, and we'll remind you that you'll have 5 calendar days to submit any supporting documents. And then from the day that you submit your appeal, HCD will have 7 calendar days to make an appeal determination. So it's, again, a short window, but we're trying to, get this program underway as quickly as possible. Next slide, please. Here are the ways that you can contact us to file a complaint or an appeal. The hotline is only for complaints. Now you can call us and ask questions about your appeal, obviously. You can call us at 832-394-6200, option 1, or email us at hcddcomplaintsappeal. There's an S on complaints, no S on appeal at houstontx.gov, or you can come to our offices at 2100 Travis at the 9th floor, and someone can talk to you. And with that, that is the end of my slide deck. If you have any questions, feel free to reach out to us. Thank you, Lindsay.
Thanks, Chris. Okay, we're going to move into how to get to the NOFA, how to review it, and how to submit it. So if you visit our website, houstontx.gov/housing/funding.htm, hashtag NOFA. On that screen, you will see a little box for Notice of Funding Availability, NOFA. So you click on that, and it takes you to our NOFA page. On this page, we have all of our featured NOFAs, which really means a NOFA that is open and accepting applications at that time. So right now, you will click on that page, and we actually have 2 open right now, and this is one of them. So on this page, if you click on the View NOFA square at the bottom of that paragraph of text, it will take you to Beacon Bid. So the city uses Beacon Bid now through our strategic procurement division. That's where any of the city's procurements are housed. So even if it's an RFP, an RFQ, any of those things are on that website. So you go there and you can download all the documentation from that website. So that brings us to how to submit it. So submitting the application. So at the very top right-hand corner, it says get on the interest list. You click that. And if you do not already have a Beacon Bid account, it asks you for some very simple information. It's super easy to set up an account. And you do that. And once you hit submit here, you will get an email. And from that email, you'll have instructions on how to submit your response. You can download the package and review it. And then when you're ready, you can go to submit your response. So within, once you're in the portal trying to submit, you have a lot of different steps to go through in terms of getting all the application material in there. The good thing is that when you download the application package, you have a application checklist. And so that is kind of like your guide on how to get everything that you need and whether you have it or not. So first step in submitting is to download that application checklist and just start going down it. I would do that before you even really get into Beacon Bid and try to upload anything. Download the application checklist and just start going through each piece and making sure you have it. So I wanted to explain, earlier I talked about threshold documentation. So here on this screen, I don't know if you can see it, it's very small on my screen, but there are each of the threshold requirements listed, and there's an option to attach something. So for each threshold requirement, you will attach documentation that supports that you meet that threshold. If you have questions about that, please ask those early so that we can kind of sort that out before you get to that very last day and you're trying to get the application in. Just try to, think it through before then so you can ask any questions you may have. So first you'll go through and put all your documentation for the threshold showing us yes, I meet this, yes, I meet this. And then you'll move to the application documentation, which is the meat of your application. What is it that you're doing? Your scope, like what is it? And so each of those has a piece as well. And you'll upload these here. And then finally, as with anything with the city, there's always going to be some required forms. So you'll put those here, and all those forms should be available when you download the application package. But if you're missing anything, if there's something not quite working, please reach out to me. I'm always available to walk you through this and help in any way that I can. So I have a few tips that I've learned along the way. Number one, start early. Do not wait until the last minute, because even though it's due at 5 p.m., I guarantee you there will be some snafus like that last day. So the great thing about Beacon is you can come into the system and out of the system, and it saves your application. So you can start and come back. I don't know if anybody was around when we had a previous system called OnBase for submission, and it did not allow that, which was a little aggravating to some of our applicants. So this one is a little more user-friendly, but still don't wait till the last minute. Review everything before your final submission. Make sure everything's uploaded. The system will not let you submit if you don't upload a document that's required. So in that way, it forces you to have all the documents. Make sure everything's in the right format. The preference is PDF unless otherwise specified. For example, the budget is an Excel file. So we want an Excel file and a PDF of the budget. I think everything else will be PDF. So you have the scoring criteria and the scoring guide in the NOFA itself. So definitely make sure that you touch on every single scoring criteria. That's going to help you get the best possible score, is just by reviewing and making sure you've addressed each and everything that's listed. Make sure you have all your threshold documentation. Be clear and concise. Try to, we did not include page limits on this NOFA, but it's always helpful the more concise you are for our evaluation team, right? It just makes it easier for them if they're not sifting through pages and pages and pages of a narrative. Whatever you can say, just try to say it as clearly and concisely as possible. And also review the letters of clarification before you submit. So earlier I said that you have a question deadline and that you need to submit by that January 16th date. After that date, I will issue a letter of clarification with all the questions that were asked and all the answers. Also, if there's any changes along the way, it'll be in a letter of clarification. So that is as important as the NOFA solicitation document. So just make sure you read that before you submit, because you don't want to miss anything. The other thing I want to touch on is the no contact period. So the no contact period technically started the day that we released the NOFA. And it continues until the award is recommended and it goes to council. So what that means is that applicants and your representatives may not attempt to influence the award decision. No gifts, favors, or anything of value may be offered to the city employees, officials, city council members, anyone here at HCD. And all your questions must be sent to a designated city representative, which in this case would be myself or Jamila Glover, and we both man the hcd_NOFA@houstontx.gov email address. And so I will put that in the chat. I think it was on one of these slides as well, but that's where all questions will go. I know it's tempting to reach out to whoever you know at the city to ask a question, but technically, when you're in the no contact period, you should not be reaching out to anyone other than the designated city representative. I already talked about when it begins and when it ends. Often people want to reach out to their council member, understandably, but in this case, you're not allowed to do so in an attempt to, if you're attempting to influence the outcome of the award. That can even be just asking a council member about this NOFA. That is not allowed. So you can contact your council member about other things, but just not about this specific NOFA. Oh, there's the email address right there that you send all your questions to. And this does not prohibit applicants from making public statements at City Council or a City Council committee meeting after the official selection has been made and placed on the agenda. Okay, I think I've covered everything, and we are moving into our Q&A. And I know we have quite a few questions in the chat. So if anyone has a question, they can also raise their hand and ask it verbally.
Lindsay, you would like me to start?
Yeah, sure. I was trying to figure out where
Okay.
it started.
So the first question is like, any chance the deadline can be extended considering we're losing a week with the holidays? At this time, we don't anticipate it being extended, but that doesn't mean that it won't. So should the deadline be extended, we will put that in a letter of clarification, and we will make sure that that is done. The next question is what restrictions, if any, exist regarding age? This facility is for 18 years or older. Do we choose the population we serve, or are the age requirements given by the contract? So the age requirements are 18 and over. Are we required to serve domestic violence participants? If so, what systems are required to ensure safety and privacy? This is something that you should address in your application. This is not a domestic violence shelter, but I do think that there are partners that typically will come into play, but that is something that you should address in your application. Are we able to leverage previous award funding for the proof of funds? What would be appropriate proof of funding? So you need to have cash on hand or a line of credit. If you have previously received a funding award, and you're trying to use that as part of leverage, then you need to be able to document very clearly that the funds are still in cash, on hand, and available to be used for this particular project. What is the timeline for reimbursement once reports are submitted? So our reimbursement timeline is fairly simple. So if you spend funds in January, for the month of January, your contract dictates that on the 20th day following the month of the expenses, so in this case, it would be February 20th, the reports and the requests for reimbursement are due. Once we receive the reimbursement, then the clock starts ticking, and we have a group for public services, we have a group of funding specialists and relationship managers that review that particular report. If everything is submitted appropriately, it shouldn't take us too long. It should take us just a couple of weeks to go through it. Now, this is a really big project, so it may take us, 2 to 3 weeks to go through it. If there are documents missing, if there's ineligible costs, there will be disallowances, and then the agency will get a report of what is being disallowed, and then it goes to our finance department. Anything over, I believe it's $50,000, and if finance is on here, they can correct me if I'm wrong. Anything over $50,000 then has to also go to the controller for approval, and that usually takes a few days to get that approval, and then the agency will get reimbursed. This is why we request a 90-day working capital, because by the time you get it back, you're already in your 3rd month of spending funds. Fully operatable within 60 days. Is a grace period allotted for additional services to be added, or is everything required to be operating within 60 days? Again, the NOFA asks these questions, and so there is an opportunity for each agency to address that operational piece. Will there be an opportunity to tour the building? So we're currently in the process of owning the building or purchasing the building. And so once that's done, we can have a conversation about that, but not until after the purchase of the building can we entertain any tours at this time. Will the city be responsible for maintaining the laundry room? The maintenance of the laundry room will fall on the operator. Will you meet all requirements? If you meet all requirements but have not met the 5-year time frame, does that disqualify the application? So we had threshold requirements, and so the timeline on that requirements must be met. And is there any more questions? Let's see. Did you say the budget? Yeah, so but the budget needed to be both in Excel and PDF. What equipment, furnishings is in the facility? That's a really good question. I think that one we need to actually write that down for you. So that way I don't mess up on this one. So we will put that one in writing and issue a letter. I guess is it called a letter of clarification, Lindsay?
That's right.
Yes. So we will answer that. And I'm getting notes, so I may come back to that question. The NOFA references a requirement for long-term follow-up. What is defined as long-term? So the long-term follow-up is typically in our way home system. We're going to follow the same type of requirements. So we will look at when somebody exits, 60 days. I think it's like 60 days, 90 days, 120. And so we can also make sure we address that correctly. Who will pay for the utilities at the site? So that should be part of your budget. So the agency, the operator will pay for utilities, and then the city will reimburse for that. DR funds don't typically cover things like food, pet costs, mental health, etc. Will the city be providing funding outside of disaster recovery to fund these items, or is the operator responsible for these items? So the city is currently looking to fund additional dollars outside of the federal dollars to address those needs. In addition to the pet care, we do have an agreement with BARC, which I don't know what that acronym is. So if somebody does know the acronym of BARC. We're working on an agreement with BARC to provide some veterinarian services, some kennel services, and food for pets. BARC is the City of Houston's animal department. We love our acronyms. I struggle with them sometimes. Okay, let's see. Will HPD have a team on site? And if so, what will be their role? So there have been conversations with HPD to be on site. That is to be determined. We don't have that finalized yet. And so as that comes to fruition, we will notify you. Can we submit a collaborative? Go ahead.
Can I add to that, Melody, that we want to make it clear that HPD will not be responsible for providing security on site?
Yes. Can we submit a collaborative application with the partner agency? Collaborative applications are fine. However, there has to be one lead entity, and that lead entity would need to submit that application. We would engage with one operator. So when you think about your collaborative application, who's in charge, who's holding that information. What's the hardest part of the application to complete, or the most important part of the application in the committee's decision-making process? It's going to sound like I'm just going to say it or whatever, but it's the entire application. We worked really hard to put this application together to address all the needs that were necessary to ensure a good project, a good proposal. And so I wouldn't say that there's just one piece that's the hardest. I think you have to look at it as like from a holistic standpoint. So it's really important that all of them, every part of it is answered appropriately. Is the operator responsible for staffing the clinic, or will the city contract with the clinic partner? It's a really good question. At this time, the city does not have a contract with a clinic partner. Should that change, a letter of clarification will go out. But I think that is something that agencies should propose in their projects on how they could partner with that, with the clinic provider. Is there a set date to select the operator that wins the bid? So Lindsay went over the timeline, and if you can remind me, Lindsay, the timeline that it's an estimated timeline. So we hope to have a decision made by.
So the the NOFAs are due on January 23rd. So we have a threshold review and then the evaluation committee scores. So the earliest we could have an award would be mid-February.
And that's, and when she says that, I just want to be really clear, that is the earliest we could have something. That's if we don't extend, that is if everything aligns, nobody takes vacation. So I just want to
Yes.
manage expectations. So
Yeah.
it could take 30 to 45 days for us to select an operator once it closes. And
Right.
Lindsay's going to keep us on track. If parking on site is not available for staff, is there parking available nearby for them? I don't have a definitive answer. I understand that there is possible partnerships that could be made for additional parking. And we are working on that. Will there be security measures put in place, i.e. security cameras, badge access, etc.? That is something that should be a part of your application. That is a specific question on how your organization would manage the security portion of this. Can you explain what it means, what is meant by a law enforcement call line noted in the NOFA? Could this just be one phone number designed specifically for calls from law enforcement? That's a really good question. I do not have the answer at this time for that, so I will. We will have to take that one and then we will respond in writing. Related to the security cameras, there are security cameras. There will be security cameras in the facility already there. When you mention clinic, is it a satellite medical clinic, an outpatient behavioral health clinic, or both? Well, that's going to be part of your application, so you will please let us know what your thoughts are on that. Will the city provide EMTs, or will this also have to be included in proposal? So this should be part of the proposal on how medical, any type of triage, partnerships, or others you would have in which you would plan to bring. Please clarify the parking. There's a huge parking lot alongside the side of the building. When it was operated by Star Hope, they had a lot of staff and there's plenty of parking. Is the current parking lot not available? There is still a parking lot on the side of the building that is available for use. And I'm not sure, I'm not sure if that's what you're talking about. So we will address that as well in writing. All right. I think I answered all the questions.
Oh, I think
There's
Amber
one-
had one more question.
Okay. Oh, is it expected that medication be managed by staff on site, or are residents able to independently store and manage their own medication? So I think this is also part of the proposal. I think there are different methods that different providers use. And so we'd be interested to know how best that looks for a facility like this. Now I think I answered everything. Any other questions? And I don't see any hands up either. So if you think of a question, and Lindsay had mentioned this earlier, if you think of a question from now until January, I forgot the date, please submit them to us. We are happy to answer them. If you're like me, usually my best questions come at 3 in the morning. So, so please at that time, don't call me, but email us, actually email Lindsay or at the hcd_NOFA@houstontx.gov, and we will get a response to you as quickly as possible. Thank you, January 16th.
Yes, thank you everyone for attending. And if any questions come up, please send those to the email and we'll get them answered for you. We appreciate your time. Thank you.